Hello, and welcome to the fourth presentation in this online presentation series, Tobacco Cessation Coverage in State Health Insurance Marketplaces, What You Need to Know. Your presenter today is Jennifer Singletary, the Director of National Health Policy at the American Lung Association. Jennifer, now to you.
Thanks, Anne. Today we're going to talk about the state health insurance marketplaces and tobacco cessation coverage requirements. After watching this webinar, you will be able to define a health insurance exchange and explain who buys health insurance there, identify requirements for tobacco cessation coverage in marketplace plans, and explain what the cessation guidance is. First, I'll explain and define my acronyms. The ACA is the Affordable Care Act, or Healthcare Reform, Obamacare, whatever you would like to call it. HHS is the U.S. Department of Health and Human Services. That's the main federal agency implementing the Affordable Care Act. CMS is the Centers for Medicare and Medicaid Services. They are the main sub-agency under HHS who are implementing the coverage requirements and many other parts of the ACA, but specifically the requirements for coverage that we'll be talking about. The EHB is the Essential Health Benefit, and I'll get into what that means in a second. The USPSTF is the worst acronym on this list. It stands for the United States Preventive Services Task Force, and again, I'll get into what that is in a second. And lastly, not an acronym, but still a term to understand, is an exchange. When I say exchange, I mean the same thing as the state health insurance marketplace. And again, I'll explain what those are in a second, but just know that I'm using the terms interchangeably, exchange and state health insurance marketplace. So if we're talking about state exchanges, we have to be talking about the Affordable Care Act. The two are inextricably linked. The Affordable Care Act, as you probably know, was signed into law in March of 2010. And one of the hallmarks of the law is attempting to get more people insured or to close the uninsured gap. Before the ACA, we had the lowest income folks being covered by Medicaid, and we had higher income folks being provided health insurance through their employer as an employee benefit. And we had the over age 65 being covered by Medicare. But there was still a gap of folks who are uninsured. They make too much money for Medicaid, but they don't make enough to pay for health insurance either on their own or their employer doesn't offer health insurance, etc. So the ACA attempted to fill this gap by expanding Medicaid, which is a different presentation, but the ACA also creates state health insurance marketplaces or exchanges to fill this gap and provide health insurance to folks who didn't have it before or didn't have good options to buy health insurance. The other thing to note is in the exchanges, citizens with incomes up to 400% of the federal poverty level are eligible for subsidies from the federal government to buy insurance through the exchange. So not only did the ACA create this new system of state exchanges to provide health insurance to people who couldn't buy it elsewhere or not covered by Medicaid, but it also set up a system to provide assistance to people who were not getting insurance through their employer, which often is heavily subsidized. So basically setting up a subsidy structure so that folks who are self-employed or unemployed or in any other variety of situations can get subsidized health insurance. So if you're a family of one, if you're one person and you make up to $46,680 annually, you are eligible for a subsidy to buy health insurance through the exchanges. And of course, the subsidies are adjusted based on your income. So the highest income is going to get a smaller subsidy than lower incomes. So what is a state exchange or a state health insurance marketplace? In essence, it's a marketplace to facilitate the purchasing of health insurance. It's, essentially if you envision a market where you're buying plans like this picture illustrates, the official state marketplaces or exchanges, that's where you have to buy insurance if you want that federal subsidy I just talked about. So the official exchanges are the only way to buy health insurance with a federal subsidy. Additionally, the marketplace, a lot of people think about healthcare.gov and how the marketplace is online, which is how a lot of people are enrolling. But it exists far beyond online. You can also enroll with paper, or you can enroll through a navigator, which is someone who has been trained to basically walk people through the options and how to enroll. So you can enroll in a variety of ways, and it's not only a website. It's really conceptually a marketplace, a place to buy health insurance that was set up by the Affordable Care Act in every state. And here's some more information about the state exchanges. There are 3 types of exchanges if you're thinking about the structure or how it was set up. Some states have a state exchange, state-based exchange. So in that case, the state set up the exchange and is running it completely. So obviously they're doing it with advice and guidance and regulation from the federal government, but in this case the state is running their own exchange and they are pretty autonomous in doing that. Contrast to that is the federally facilitated exchange or marketplace, which is where the federal government sets up and runs the exchange. These are in states that decided not to set up their own exchange for a variety of reasons. The third kind of exchange is a partnership exchange. So in the partnership exchange, the state is responsible for plan management and consumer assistance, but the federal government is responsible for other aspects of the exchange. Partnerships are essentially for states that were not able to get their systems up and running by January 1st, or by enrollment, which was before January 1st, 2014, and so needed some help from the federal government to fully implement the exchange. But the idea of a partnership is that the state will eventually move to a full state exchange. The original vision of the Affordable Care Act was that all states would eventually be running their own exchanges. And of course, we're only a year in right now, so that is still to be seen. But some states are running their own exchanges, and some of them have federally facilitated exchanges. The important thing to know is that regardless of what type of exchange your state has, everything can be accessed through healthcare.gov. Even if the state is operating its own website, it's linked to from healthcare.gov. So that's really the best place to send people if they're interested in enrolling. The other thing to note is that regardless of what type of exchange your state has, the coverage requirements are still state-based. Even if you have a federally facilitated exchange, the state still got to make some decisions about the coverage requirements, and we'll get into that in a second. If you're watching this presentation and you don't know what type of exchange your state has, or you want to know more information about how it was set up, what the structure is, etc., a great place to look for that information is the Kaiser Family Foundation website. And we've linked you directly to their information about health reform, including the state exchanges. So if you want to go to www.kff.org/healthreform, that's a good place to look to see what the structure of your exchange is, who are the people in charge of it, all kinds of details like that, and what's going on right now in your state. Maybe they're considering moving from a federally facilitated exchange to a state exchange, or whatever changes they might be considering. That's a great place to find out what's going on in your state. Now that you know something about exchanges or marketplaces, let's talk about what is required for tobacco cessation in these exchanges. If we're talking about coverage requirements in the exchanges, the main concept for you to know is the Essential Health Benefit, or EHB. The Essential Health Benefit was created by the legislation of the ACA, so it's written into the bill that was passed. And the essential health benefit is meant to be a minimum federal standard of coverage requirements. So the essential health benefit contains every health care benefit that is essential, deemed essential, to healthcare coverage. And the legislation includes a list of 10 different coverage categories. So this list is, these are the categories that all the health insurance plans created in the state exchanges are supposed to have in their coverage. And the coverage categories are to the left on your screen. I've highlighted the ones that are particularly relevant to tobacco cessation, which are mental health and substance use disorder services, prescription drugs, and preventive and wellness services and chronic disease management. That's a mouthful. So we'll mostly be talking about the preventive and wellness services requirement because that brings in tobacco cessation most directly. But just to note, the mental health and substance use disorder services, that includes mental health parity, which is an important concept. And it also obviously includes prescription drugs, which are some of the treatments available to help smokers quit. Now this, I'm going to vastly oversimplify things, but you don't need to know all of the complicated regulations and rules that have come out and all the details about that. All you need to know is in the essential health benefit, which is required coverage for every plan offered in a state exchange, regardless of whether you're federally facilitated or you're a fully state exchange, doesn't matter. Any plan offered through an exchange has to cover preventive services as part of the essential health benefit. And there's a whole definition for preventive services, but some of the services that are required to be covered are services given in A or B by the U.S. Preventive Services Task Force. Now, the task force is this group of experts, volunteer experts, who go through preventive services and determine which ones should be provided to a certain population of patients. So they'll make recommendations for healthcare providers. You know, you have patient X who is this age and this gender and has this medical history, and therefore they should get X preventive service, essentially. So it's a whole variety of preventive services that are required to be covered. But what to know here is that tobacco cessation interventions is one of those A-grade recommended services. So the USPSTF has given tobacco cessation an A grade, which means it's required coverage for any plan sold in the exchange. So you might be asking yourself, well, what in the heck does that mean? Tobacco cessation is a required preventive service, required for coverage in the exchanges. What does that mean in practice? What does that mean for the patients who are trying to quit? Well, that was a big question for many years since the ACA was implemented. And in May of 2014, we got some new guidance about what it means to cover tobacco cessation as a preventive service. This guidance was really needed because the A recommendation from the USPSTF did not translate well into insurance policy language. It wasn't written as insurance policy. It was written as recommendation for clinicians. So it didn't spell out that plans must cover XYZ with these limits or without these limits. There was no language like that. So many advocacy organizations and nonprofits have asked HHS to put out guidance telling health insurance plans what this requirement means, what they're supposed to be covering as a preventive service for tobacco cessation. So we got that guidance in May of 2014 in the form of an FAQ, so frequently asked question. And the departments implementing ACA put out these FAQs a lot. So just know that if you go and click on this FAQ, just know to scroll down to Q5 because there are a lot of different questions in there that are not related to tobacco cessation. So just scroll down to question 5 when you're looking at the guidance if you choose to do so. But you don't have to go looking for the guidance because I'll tell you right here what the guidance says. The guidance says that plans in the exchanges should be covering at least 4 sessions of individual, group, and phone counseling. Those are the 3 formats of counseling that have been determined to be effective for tobacco cessation. Plans should also be covering at least 90 days of all FDA-approved smoking cessation medications when prescribed. Now, they have to be prescribed because that's how insurance coverage works, but this also includes the over-the-counter medications. So we're talking about the nicotine patch, gum, lozenge, which are all over the counter, but can be covered through this benefit with a prescription. Additionally, we're talking about the nicotine nasal spray and inhaler, and bupropion and varenicline, and those are all prescription medications. All of these medications should be covered by plans offered through the exchange. These benefits should be covered for at least 2 quit attempts per year. We know that quitting is a process and often involves some relapsing, and smokers often have to try a couple times before it takes. So it's very important that plans allow smokers multiple quit attempts. It's not just a one shot and then you're done, that you can use the benefit multiple times. So at least 2 quit attempts per year. The Lung Association would recommend that there be no limit there. Also, this benefit should be covered with no cost sharing. Cost sharing involves basically 3 things. It could be a coinsurance, which is when you pay a percentage of the cost of the treatment. So say your coinsurance is 20% and the treatment costs $100, so the patient pays $20. That's cost sharing. Cost sharing is also paying a deductible. So that's when you have to pay up to a certain amount before your insurance coverage basically kicks in. So this benefit needs to be required without contributing to the deductible. And lastly, cost sharing can also be a copay. So that's a set fixed amount that the patient pays when they're filling a prescription or when they are at the doctor's office. So this should be covered without copays. Basically, what this gets at is that anytime a patient has to pay for a treatment, they're less likely to use it. And we want patients to be using these treatments to help them quit smoking. Lastly, the benefit should be covered without prior authorization requirement. Prior authorization is when a patient or the doctor or the healthcare provider has to basically ask the insurance plan permission to give that treatment. So say a doctor and a patient decide that the patient wants to quit using the gum and attending group counseling session. If there's a prior authorization requirement, then often the doctor is going to have to call the insurance company or submit some sort of form and ask for permission to give this treatment. And the patient won't be able to fill their prescription or attend that counseling until the insurance company says, yes, this is approved. The problem with this is that it tends to slow down treatment, and tobacco cessation is very motivation oriented. You have to be motivated to quit because it's really hard. And slowing that process down can be discouraging for the smoker and often can cause them to give up altogether or to decide not to use treatment and to just go cold turkey, which we know is not the best way to quit smoking. So prior authorization should not be required for tobacco cessation medications or counseling, and that was in the guidance too. This is a great definition of a comprehensive tobacco cessation benefit. This is exactly what plans should be covering. Any plan, anywhere, should be covering for their smokers who want to quit smoking. So now that you know what's required in plans that are offered through the exchanges or the marketplaces, your question might be, well, what are plans doing? How are they covering these benefits? Are they covering them? And unfortunately, I have no answer to that question because there's a big problem right now of lack of transparency in the exchange plans. I have no way, no one has any way, of tracking what tobacco cessation treatments are being covered in these plans because there's no way to get to that information. And this information is not just important for national organizations like the Lung Association. These transparency issues are really a problem for patients and for doctors and for people who are trying to buy health insurance. The basic problem is there's no way for a patient to go online, say, and maybe if they're shopping for a plan and they want to see, oh, are the drugs that I take, are they covered under these different plans? There's no way to find that out right now, at least not at the national level. And that's a big problem. So I wish that I could tell you exactly what plans are doing for tobacco cessation in the exchanges. But as of now, I can't tell you that. And the Lung Association does encourage HHS and the states to work to be more transparent about the exchanges and what is being covered in them so that we all can evaluate whether this is quality coverage that patients are getting through the exchanges. And as I note here on the slide, tracking and enforcement can happen at the state level, can and should happen at the state level. So the state regulators, like the Health Insurance Commissioner and other regulators, people in charge of the exchanges, they're the ones that can track what is happening. They can require the plans to report to them. And so they can figure out what's happening and enforce this requirement and many other requirements under the ACA. So if you're interested in finding out what's going on in your state and how plans are covering these treatments in the exchange and whether they're following the guidance that I just talked about, my suggestion is to talk to the person who's in charge of your exchange and see if they're willing to track this coverage and report, who is covering what and to enforce that guidance.
Thank you, Jennifer. Now a couple questions. Our first question is, I think I qualify for a subsidy. Do I have to buy insurance through the exchanges in order to get that subsidy?
And the answer to that is a simple yes. Users or patients have to buy their insurance through an exchange to receive the federal subsidy that will help them pay for health insurance. Now, some plans are still being sold outside of the exchanges. You can buy an individual plan or a small group plan on the market outside of the exchange. But as of now, you can't use a federal subsidy to buy plans outside of the marketplaces.
Thank you, Jennifer. The next question is, I've heard that grandfathered plans don't need to cover preventive services. How do I know when I'm shopping in the exchange if a plan is grandfathered or not?
So a grandfathered plan, for those who don't know, is a plan that existed before the ACA was enacted in March of 2010 and hasn't made significant changes to the plan coverage or the structure, because whenever they make significant changes, it triggers them losing their grandfathered status. So these plans existed before the Affordable Care Act. So the answer to the question is there are not any grandfathered plans being sold in the exchanges because all the plans being sold in exchanges didn't come into existence until January 1st, 2014. So if you're buying insurance through an exchange, you do not have to worry about figuring out whether a plan is grandfathered or whether the ACA requirements apply to it, because they all came into existence after enactment of the law, and so the ACA applies to all plans sold through the exchange.
Thank you. The next question is, what happens when my state didn't set up an exchange? Can I still get a health insurance subsidy to buy insurance?
Yes. For the user or the patient who's looking to buy health insurance, there aren't a lot of differences between states that set up their own exchanges versus states that are using the federal exchange. For the user experience, it's going to be almost the same, and everyone can use healthcare.gov to look for insurance. If you have a state-based exchange, healthcare.gov might direct you to a new website. But basically, healthcare.gov is still the portal that you can direct anyone to buy insurance through the exchange and to use their subsidies that they might be eligible for. So the point is, functionally, for the patient, the requirements are the same for state-based versus federal exchanges. The portal is the same. It's pretty much the same from the user perspective.
Thank you for watching this online presentation today. If you would like to learn more, please visit www.lung.org/cessationTA. If you have specific questions, please feel free to contact Jennifer or Anne at the email addresses listed below. We hope you enjoyed today's presentation and look forward to having you watch the other 4 presentations in this online presentation series at your earliest convenience. Thank you. Hope to see you soon.